Right, you know, sometimes these winter months, they just kind of drag on and people are over it and they start kind of having some effects of anxiety, panic attacks. They cannot wait for the warmth of spring. Dr. Rob is here. He's going to help you reach a state of calmness, and it seems that you've got some pretty good remedies here.
Yeah, I've got some quick remedies.
Okay.
I mean, who doesn't? This time of the year, it gets so agitating for so many people. It's the end of January. The bills are coming due from all the Christmas spending, right, and presents and everything. And then the New Year's resolutions, I'm going to lose weight, I'm going to stop smoking. They get 3-4 weeks into it. You know, they've fallen off the wagon a couple times. They're waiting for the warmth of spring to come. And people just start getting edgy and agitated, irritated. Some people start getting the gastric complaints. You know, they get nervous, they get the irritation there, or start getting vague pain symptoms. And it just all starts to build up. Well, we have tips for you today on very simple remedies that can help calm you down. And we're going to teach you exactly how they work, because we have a picture of one of the receptors that's actually in your body and how these supplements work to calm you down.
Okay. And so when we're talking about, you mentioned some of the symptoms. Let's one more time. Gastric problems, anxiety.
It's a little bit different for everyone. Some people, when they get edgy, they kind of get angry. Other people feel agitated. Some people have trouble sleeping. They can't get to sleep. They can't stay to sleep.
Yeah,
well, you've got a little bit of different hormones kind of raging right now with the little one on the way, right? And then some people perceive their edginess as gastric complaints or just body pains. They're like, my body hurts all over in places because they're stressed, their body's agitated. And these supplements can help calm down that agitation.
Okay, where do we begin?
Well, one of my favorites is magnesium, and we have a picture of a receptor. It's called the NMDA receptor, and I think maybe we can bring that one up.
It sounds like we don't have it at this moment.
Okay, well, no problem. So inside this receptor that we all have in our bodies, they are magnesium dependent. So to shut off this channel of this NMDA receptor, we can use magnesium, which shuts down the receptor, which helps calms us. There's a couple different kinds of magnesiums. There's orotate and glycinate. There are two in particular that are very beneficial at calming you. You want to take these at night. And one of the better things to do is before you start any supplementation is probably to get your levels checked. When it comes to magnesium, get a red blood cell magnesium, or zinc to get your zinc levels. I like intracellular nutrient testing so you can know exactly what the level of the supplement is in the cell.
You can talk to your doctor about that.
Yeah, so which brings us to the next supplement, which is zinc. Zinc also works in that NMDA receptor to block that receptor, which causes a decrease in anxiousness or agitation or even panic attacks. Which is a great thing this time So magnesium and zinc in particular, it's zinc citrate that you want to use. So some zincs aren't going to work, but it's zinc citrate.
I can't pronounce that next one. Pregnenolone.
Pregnenolone, which is an actual hormone. It is actually the most important hormone in our body because it's the initial one. Cholesterol has to be converted into pregnenolone, and pregnenolone then makes all the other hormones in our body, estrogen, progesterone, testosterone, 150 other hormones you've never heard of. And so progesterone or pregnenolone is the very important one that we can supplement with. You need to know what your levels are before you start this hormone. It is a neurosteroid and a neuroactive steroid. That means it's made in the brain and it's made by the adrenal glands. Your body makes this all on its own from the glial cells in your brain. You don't want to take too much of it. It has a very sedating effect. So people that are having trouble with sleep, women who are menopausal and they can't sleep, pregnenolone does a wonderful job at calming it down so they can sleep. And if a capsule doesn't work really well, we have what are called troches that you can put under your tongue. So people that suffer from panic attacks, you can slip this under your tongue and within minutes you'll feel calm, which replaces an addictive kind of medication called a benzodiazepine, which you may have heard, like Valium, Xanax. These aren't addictive. They work in the body's own natural mechanisms. And the one that we had Zach take earlier, which is called Gaba Flow, there's another receptor that's called the Gaba receptor, and this spray works on that receptor to help calm you down, make you feel less agitated. Dr. Rob, shake it up, spray it under your tongue.
Yes, we are going to do that. We are out of time, unfortunately, but these are great tips helping you fight that seasonal depression, some of those things you're having. RenueHealth.com, and we can find all these tips.
Fantastic.